If you are on Medicare or about to become eligible for Medicare, there are some things that coming up as far as open enrollment beginning in October. So, and I know a lot of you are going to have many questions, so we decided to bring in the gentleman that could answer all those questions. Mississippi Insurance Commissioner Mike Cheney, how are you, sir?
Good to be here.
It's good to have you here. So let's talk about that. Open enrollment for Medicare Advantage and Medicare prescription drug coverage. There's a little window that's about a little less than 2 months, October 15th through December 7th.
You have 45 days to sign up for your supplements under Medicare now. 3 months before you reach the age of 65, you become eligible to apply for Medicare. Whether or not you are still covered by your employer if you're working or you have insurance, you're still eligible for Part A under the Medicare plan. So even if you have a union-sponsored health care like you might have it at the shipyard here. So if you already aren't receiving your Social Security or railroad retirement, you have to apply for Medicare.
Okay.
You still have to apply. So to apply for Medicare, you call your Social Security office. That's the first thing you need to do if you're about to turn 65 is call your Social Security office, and they will tell you what to do and how to sign up.
Now, and I'm paying close attention to this because I'll be hitting 65 in 2 years. So, you know, I'm wondering about this. You know, I'll be still, you know, hopefully still working here at the station, but I can still have my insurance here and also be on Medicare?
If you have Part A and you're still working after you turn 65 and you have health insurance, you can keep your health insurance and you do not have to buy Part B. But now this is really important. If you do not have insurance when you get Part A, you've got to buy Part B. If you don't buy Part B, then the federal government penalizes you severely for every few months that you don't have Part B. And if you don't have it for at least 2 years, then you receive no benefits at all. So you better sign up. So I used to tell folks, well, I didn't have to sign up for Part A. And they say, oh, you did too? And I said, I didn't call Social Security. Well, I found out my sweet, wonderful wife, who loves me so much, called Social Security for me and said, he's turning 65, sign him up. So if you're
Our ladies always watch out for us, don't they?
Watch out for your spouse, you know,
there you go.
Or your mother or somebody. Sign them up, make sure they get Part A.
Okay.
Call Social Security office. That's the first thing you do.
Now, as of 2020, January 2020, new benefit choices will take effect, correct?
New benefit choices, and I can't tell you what they are at this moment.
Well, they no longer sell Medigap?
No Medigap policies. Now, that's called the donut hole.
Okay.
So what happens if you turn 65, say in June or July, you've got several months before you're eligible to enroll in Part B. You need to have something that will cover you. Most people that turn 65, say in June, July, April, May, or June, after the enrollment period, will keep their insurance if they're working for someone under COBRA. That's the idea behind COBRA, and that becomes your secondary insurance. Basically, that just means that Medicare A pays first, and secondary would be your, if it's Blue Cross, United, or whatever you have. So you need coverage until the open enrollment period. So the open enrollment period is October the 15th this year through December the 7th. That's 45 days. If you miss that enrollment, you have to wait until the following year to be covered. You will not be covered if you wait until January, until July. So you need to make sure you fill in that little open enrollment area with buying your product that you want. And if you're worried about where to find something, we have a supplement that you can order from the department. I want you to see this, if they can zero in on it. I've got to find out where the cameras are. And you can look at it, and it's on our website, www.mid.ms.gov. That's gov. If you don't know how to do it, call your library. You still have a library down here on the Gulf Coast.
Yeah,
and ask them how to get on, and they'll tell you. They'll do it for you.
That's awesome. Now,
and it's got everybody that sells here, and it's got their phone number and who to call. And we're going to talk about, I hope you ask me who can sell you a product.
Well, that was, you know, I was going to say individuals who contact you about any type of private Medicare coverage, there are some things, I mean, they have to be licensed by the state.
Oh yeah, you got to have a license from our department, from the Mississippi Department of Insurance. And you can check with us at the site that we just talked about, www.mid.ms.gov, or you can call us at 1-800-562-2957. That's 1-800-562-2957, and we'll help you. If they don't have
the numbers on the bottom of your screen, as well as that website.
So, somebody that's selling you a product may not make an unsolicited contact. In other words, they just can't call you up on the telephone, robocall, hey, you need a supplemental policy. I see you just turned 65, because information's available today to look at that.
Right.
So we prohibit anyone from contacting you, such as door-to-door sales and departments, to make sure that you can't contact somebody in the Walmart parking lot or the big lot stores or the Home Depots to try to sell them a product.
Now, you know, some definite guidelines to go by here. Don't give out any personal information, such as Social Security numbers, bank account numbers, credit card numbers, to anyone you have not verified as a licensed agent. Again, you can go to that website, like he said, and you can find, there's a list of them on there.
There's a list
of all the people that, you know, that can sell you, and you can call them and ask questions.
And never pay on the internet. And don't give out your credit card over the internet. Don't do that.
That's how a lot of people end up losing all their money. During open enrollment, you can browse and compare available health insurance plans and prices before you decide to purchase a plan. So that gives you a lot of options there, which you can do.
There's another number you may want to know about. You can verify that the plan you've chosen is to approved Medicare plans. You can call 1-800-MEDICARE, and that's 1-800. If you can't remember Medicare, it's 1-800-633-4227. But it's just easy to remember, 1-800-MEDICARE. That's the little numbers on your cell phone, or if you do have a landline, which very few people do today, that's the little numbers. Call 1-800-MEDICARE, and they can help you out. Federal assistance is available to some Medicare beneficiaries. In other words, if you have very low income, you can still get help and reduce prices. So call that number, it helps out.
All right, we got just over a minute left. I want to talk real quick about some fire safety for seniors. There's a lot of great things on the on your website as well for fire safety. That you know, if you smoke outside.
We tell you, smoke outside, don't smoke in the house, never ever smoke in the bed. And we hope most senior citizens don't smoke. You don't find many of them that do. If you have a kitchen, or you cook in the holidays, and they're coming up now.
Oh yeah.
During that open enrollment, got Thanksgiving and Christmas coming up. Keep a frying pan, if you got a frying pan on the stove. Keep a cookie sheet, so if you have a fire, put the cookie sheet over it. Never throw water on it, it'll flame up. Safety things, and don't wear loose clothing like a bathrobe around a stove. Don't let children play, especially your grandchildren, if you're cooking in the kitchen.
And one of those maybe 4 or 5 nights that we have actual cold weather down here.
Don't have a lot of it down here.
No, that's what I'm saying. We don't. So, you know, give space heater space, but there's so much more information on there. And again, you can go to the website, which is www.mid.ms.gov.
Correct.
For that, or again, the phone number is on your screen as well. So, and be sure you, you know, go on there if you become eligible. Good to see you again. As
always a pleasure.
Always a pleasure to have you down here. Okay, again, you're eligible for Medicare. You need to go ahead and go on that line and find out and protect yourself coming up.